This is Dr. Cherukupally at Regenerative Sports Spine and Spa doing a Dysport demo injection for this patient here. And we are going to get started with some gloves first. Always have to be safe. Sorry. And then this patient has already been cleaned with alcohol swabs. So we are just going to take a look and see what we need to take care of for her. And so I'm just going to have her move her face just so we know what we are injecting. We don't do blanket injections here. We do it targeted towards wrinkles and lines that you're worried about. So look up to the ceiling for me. And for this patient, she just has a little bit of a line here, so we won't have to use many units of Dysport there. And now look mad. And so just a couple more lines here, so I'll probably use a little bit more units here than I would here. And then smile big for me. And you really don't have very many laugh lines here, crow's feet or anything, so I really wouldn't do that much there. I would really concentrate most of the injections here between her eyebrows and then a little bit on her forehead. And let's get started. Okay, look up to the ceiling. All right, perfect. And then we go right along that line, and we'll always point up so that we don't get closer to the eyes. Try to avoid that. And a little bit of bleeding is very normal. A little spot bleeding, and some people have a little bit of bruising after these injections, but most people do very well. You don't really have a whole lot of evidence of having these injections even 5 minutes after having the injection. And as you can see, it can be a little bee sting, but not that bad, right? Are you having any pain or a lot of pain? Okay, very good. Okay, and so look up to the ceiling again. We'll recheck our lines, and we may want to do just a little bit up here because she has a little bitty line up there. And perfect. And now then we're going to move on to her 11s is what we call them, right between her eyebrows. Look mad again. And when we do that, we look for the muscle belly here, and then one here. And so we'll start over here. Right up, tie it kind of like a wing. So this is the tip of the wing here, and a little bit of bleeding, that's normal, and a tip of the wing here. All right, and then we'll go down the center, usually 2 injections, one in the top here, and then one a little bit lower. And then we're going to go to the right side of the wing and finish it off. And look mad again. All right, then the top of the wing right here. And again right here. And we're all done. Great job.
Perfect.
And usually the effect shows up anywhere between 3 days to 14 days, sorry. And other than that, there should be no pain. Everything good?
Everything good.
Great.
Thank you.